Have you ever wondered why people snore? Today, we're going to unravel this nighttime mystery. We'll explore the fascinating world of snoring, shedding light on what it is, why it happens, and the health implications it carries. We'll also delve into possible treatments, providing insights into how this common, yet often misunderstood phenomenon can be managed. So if you've ever been kept awake by the symphony of snores, or you're simply curious about the science of sleep, stay tuned. Let's dive into the science behind those nighttime noises. First off, what exactly is snoring? Well, in the simplest terms, snoring is a sound that occurs when your breathing is partially blocked in some way while you're sleeping. It's like a concert happening in your throat, but not the kind of concert you'd like to attend. Now let's talk about the mechanics of the snore. Imagine your throat as a narrow tunnel and air as a car driving through it. Normally, the car drives smoothly through the tunnel without causing any disturbance. But when you sleep, the tunnel may not stay as wide. The muscles in your throat, tongue, and the roof of your mouth, known as the soft palate, may relax. As they relax, they can droop, narrowing the tunnel. Now let's bring back our car, the air. As it drives through this now narrower tunnel, it becomes a tighter squeeze. The relaxed tissues in your throat can vibrate as the air rushes past. And voila, you have the not-so-sweet symphony of snoring. It's also worth noting the role of the uvula in all of this. That's the small, bell-shaped piece of tissue that hangs at the back of your throat. When your airway is obstructed, the uvula can swing back and forth, adding to the vibration and thus the snoring sound. Let's not forget about the nose. Sometimes, snoring can be caused by a stuffy nose. When the nasal passages are blocked, it forces you to breathe through your mouth, which can increase the likelihood of snoring. It's also important to remember that snoring isn't always consistent. You might snore loudly one night and then sleep quietly the next. This could be due to changes in your sleep position, alcohol consumption, or even changes in your weight. So, now that we know what snoring is, let's explore why it happens. Because understanding the why can help us figure out how to turn the volume down on that nightly concert in your throat. Why do some people sound like a freight train when they sleep? A question that has undoubtedly crossed the minds of many, especially those who have spent a night within earshot of a prolific snorer. The causes of snoring are as varied as they are complex. Let's begin by understanding that snoring is essentially the sound of resistance and turbulence in the upper airway. In simpler terms, it's the noise made when the flow of air causes the tissues in the back of the throat to vibrate while we sleep. Certain factors can increase this resistance and subsequently the likelihood of snoring. One such factor is the sleeping position. Lying on your back can cause the tongue to fall back into the throat, narrowing the airway and increasing the vibration. Alcohol consumption, especially close to bedtime, is another common culprit. It relaxes the muscles in the throat and decreases the body's natural defense against airway obstruction, making it more likely for snoring to occur. Body weight also plays a crucial role in snoring. Extra weight around the neck can squeeze the internal diameter of the throat, making it more likely to collapse during sleep, causing a snoring sound. This is why snoring is often associated with obesity. Age, too, is a factor. As we grow older, our throat becomes narrower and the muscle tone in our throat decreases. Consequently, the chance of snoring increases. Lastly, snoring can also be a symptom of sleep disorders like sleep apnea. This condition, characterized by pauses in breathing or periods of shallow breathing during sleep, can lead to frequent waking from sleep and heavy snoring. In conclusion, the reasons for snoring are manifold, from lifestyle choices such as alcohol consumption to unavoidable factors like age. It's important to remember that while snoring may seem harmless or even humorous to some, it can be a sign of serious health conditions. Now that we know why people snore, let's look at the health risks associated with snoring. Snoring might seem harmless, but it can actually be a sign of serious health problems. While we may often joke about the loud rumbling sounds that some of us make while we're off in dreamland, excessive snoring is no laughing matter. It's a common misconception that snoring is just a nuisance, but in reality it can be a red flag signaling some quite alarming health issues. Let's start with sleep deprivation. A person who snores heavily often experiences disrupted sleep. This can lead to daytime fatigue, irritability, and even difficulty concentrating. Not only does the person snoring suffer, but anyone else sharing the bed is likely to have their sleep disturbed as well. Over time, this lack of quality sleep can impact overall health and well-being. Now, let's dive a bit deeper. Chronic snoring can be a sign of a more serious condition known as sleep apnea. This is a disorder characterized by frequent pauses in breathing during sleep, leading to a drop in oxygen levels in the blood. If left untreated, sleep apnea can increase the risk of heart disease, high blood pressure, and even stroke. Heart disease, the leading cause of death globally, has been linked to snoring. The strain that snoring puts on the heart can lead to an enlargement of this vital organ, which can result in higher blood pressure and an increased risk of heart attack and stroke. Furthermore, snoring can also cause high blood pressure or hypertension. When your sleep is interrupted by snoring, your body becomes stressed. This stress causes your blood pressure to rise, and over time, this can lead to hypertension, which in turn increases the risk of heart disease and stroke. In conclusion, while snoring might seem like just an annoyance, it can indicate some serious health concerns. It's important to not ignore persistent loud snoring and seek medical advice if you or a loved one is affected. But don't panic just yet. There are treatments available for snoring, and we'll be discussing these in the next scene. Stay tuned. If you or a loved one snores, there are ways to address it. Let's delve into the many treatment options available, ranging from lifestyle changes, over-the-counter aids, prescribed medical devices, and even surgeries. Remember, severe snoring should always be evaluated by a healthcare professional, as it can be a symptom of a more serious condition. Lifestyle changes are often the first line of defense against snoring. This usually involves modifications such as losing weight, quitting smoking, avoiding alcohol and sedatives before bed, and changing sleep positions. For instance, sleeping on your side rather than your back can help to keep your airway open and reduce snoring. Then, there are over-the-counter solutions like nasal strips, which can open up your nasal passages, or throat sprays that can lubricate the tissues in the back of your throat, reducing the vibrations that cause snoring. For more severe cases, prescribed medical devices could come into play. One commonly recommended device is a continuous positive airway pressure, or CPAP machine. This device delivers a continuous flow of air through a mask to help keep the airway open during sleep. There are also custom-fitted oral devices designed to keep your airway open by bringing your lower jaw or your tongue forward during sleep. In some cases, surgery may be considered as a last resort when other treatments fail. Procedures can range from removing excess tissue in the throat, correcting nasal problems, or adjusting the structures in the upper airway. Remember, it's crucial to consult a healthcare professional if you or a loved one snores heavily or experiences pauses in breathing during sleep. This could be a sign of a more serious condition like sleep apnea, which requires professional medical attention. The journey to a quiet night's sleep may require some trial and error, and patience is key. But with the right approach and guidance from a healthcare professional, it's possible to find a treatment that works. With the right approach, it's possible to reduce or even eliminate snoring. So there you have it, a comprehensive look at snoring. We've explored the ins and outs of this common, yet often misunderstood phenomenon. We started our journey by delving into the question of what snoring actually is, a question to which we found the answer lies in the vibrations of the respiratory structures as we sleep. We then shifted gears to examine the reasons behind why people snore. We discovered that it's often due to obstructed air movement, whether from a misaligned jaw, narrowed airway, or even just a night of heavy drinking. Next, we turned our attention to the health risks associated with snoring. We learned that it's not merely an annoying habit, but it can also be an indicator of serious health issues, such as sleep apnea or heart conditions. Finally, we rounded off our discussion by exploring the various treatment options available for snoring, from lifestyle changes and anti-snoring devices to medical procedures. In essence, snoring isn't just a disturbance to our or our partner's sleep. It's a phenomenon that requires our attention and understanding, and in some cases, it might even necessitate medical intervention. Remember, snoring is not just a nuisance, it can be a sign of serious health problems. So if you or someone you know snores excessively, it may be worth a trip to the doctor. Sweet dreams.